Top 30 Home Health Aide Interview Questions and Answers. Prepare for your next caregiving role with confidence. This video covers the top 30 home health aide interview questions and answers to help you showcase your skills, experience, and professionalism. 1. Can you tell us about your previous experience as a home health aide? In my previous role as a home health aide, I provided in-home support for elderly and disabled clients, assisting with daily living activities such as bathing, dressing, and medication reminders. I worked with a variety of patients, including those recovering from surgery and individuals with chronic conditions. I also managed light housekeeping, meal preparation, and reported health changes to supervisors. My responsibilities required compassion, patience, and strong observational skills. I developed trusting relationships with clients and families, ensuring their comfort and dignity. My experience has prepared me to provide high-quality, personalized care in a home setting. 2. What motivated you to become a home health aide? I was inspired to become a home health aide after caring for a close family member who was ill. The experience made me realize how impactful, compassionate, hands-on care can be in someone's life. I discovered I had a natural ability to comfort and assist people, and I wanted to use that skill to help others maintain their independence and quality of life. This field allows me to make a difference every day, building meaningful relationships while supporting patients' health and emotional well-being in the comfort of their own homes. 3. Do you have any certifications or training related to home health care? Yes, I have completed a certified home health aide training program that included coursework in personal care, nutrition, infection control, and CPR/first aid. I also received hands-on clinical training to reinforce practical skills. Additionally, I hold certifications in Basic Life Support (BLS) and have taken continuing education classes in dementia care and safe patient handling. These certifications have equipped me with the knowledge and techniques to safely and effectively care for patients with diverse health needs. I stay updated with ongoing training to ensure my skills meet industry standards and best practices. 4. How do you handle the physical demands of this job? Lifting, bending, long hours. I maintain a regular fitness routine to ensure I'm physically prepared for the job's demands. I also use proper body mechanics and lifting techniques to prevent injury, such as bending at the knees and keeping patients close when lifting. I take short breaks when possible to avoid fatigue and stay hydrated and nourished to maintain energy levels. I am mindful of pacing myself throughout the day, especially during long shifts. My training in safe transfer techniques and the use of assistive devices like gait belts helps me perform physically demanding tasks safely and effectively. 5. What types of patients have you worked with? Elderly, disabled, chronic illness? I have worked with a wide range of patients, including elderly individuals, people with disabilities, and those with chronic illnesses like diabetes, heart disease, and COPD. I have also cared for individuals recovering from surgery or stroke and patients with cognitive conditions like Alzheimer's and Parkinson's disease. Each type of patient required a unique approach, whether it was assistance with mobility, managing medications, or providing emotional support. This diversity in experience has helped me develop flexibility and empathy, ensuring I can adjust my care style to meet each patient's individual needs and preferences. 6. What are the key duties of a home health aide? The key duties of a home health aide include assisting patients with daily living activities, such as bathing, grooming, dressing, toileting, and feeding. HHAs also monitor patients' health by observing vital signs, physical condition, and behavioral changes. They may help with mobility and transferring, prepare meals following dietary guidelines, and ensure medications are taken as prescribed. In addition, HHAs perform light housekeeping, provide companionship, and report changes to the healthcare team. Maintaining patient safety, comfort, and dignity is central to all responsibilities. Their support enables patients to live independently in their homes while receiving necessary care. 7. How do you assist patients with personal hygiene, bathing, grooming, toileting? I approach personal hygiene tasks with respect, sensitivity, and a focus on preserving the patient's dignity. I start by explaining each step to make them feel comfortable and maintain a safe and calm environment. For bathing, I ensure the water temperature is appropriate, use gentle products, and support them safely in or out of the tub or shower. When assisting with grooming, I help with tasks such as hair brushing, shaving, and nail care as needed. With toileting, I offer privacy while remaining close for safety. Assisting as required, and ensuring cleanliness afterward prevents skin issues or infections. 8. Can you describe how you help a patient with mobility issues? When assisting a patient with mobility issues, I first assess their specific limitations and use the appropriate assistive devices, such as walkers, wheelchairs, or gait belts. I provide physical support and verbal encouragement while ensuring their safety during transfers, such as from bed to chair or during ambulation. I always use proper body mechanics and follow any physician or physical therapist guidelines. I also help them perform prescribed exercises to maintain or improve mobility. My focus is on promoting independence while preventing falls or injuries. I monitor for signs of pain or discomfort and adjust my approach as needed. 9. How do you prepare meals while considering dietary restrictions? I begin by reviewing the patient's dietary plan or restrictions, whether they are related to diabetes, hypertension, food allergies, or other medical conditions. I plan balanced meals that meet their nutritional needs while respecting personal preferences and cultural habits. I check food labels, avoid prohibited ingredients, and follow proper food safety protocols. If the patient requires a specific texture or consistency, such as pureed or soft foods, I ensure the meals are prepared accordingly. I also encourage hydration. Throughout meal preparation, I maintain cleanliness and engage the patient in choices whenever possible to promote dignity and satisfaction. 10. What steps do you take to ensure a patient takes their medication correctly? Although home health aides do not typically administer medications, I assist patients by reminding them to take their prescribed medications on schedule. I follow the care plan and ensure that the correct dosage is taken at the right time. I help patients organize medications using pill boxes or charts and keep track of medication intake. I observe for any side effects or reactions and immediately report them to the nurse or supervisor. I also encourage patients to take their medications with water or food as directed and educate them, when appropriate, about the importance of medication adherence. 11. How do you monitor and report changes in a patient's condition? I observe patients closely for any physical, emotional, or behavioral changes, such as fluctuations in appetite, mood, skin condition, or mobility. I document these observations in a clear and timely manner and report significant changes immediately to the nurse or supervisor, following proper protocol. Communication is key, so I ensure all relevant team members are informed. I also listen to patients and their concerns, which may indicate subtle changes in their health. By staying vigilant and proactive, I help ensure early detection of potential issues and contribute to a responsive, coordinated care plan. 12. Have you ever worked with patients who have dementia or Alzheimer's? How did you handle it? Yes, I've cared for several patients with dementia and Alzheimer's. I use calm, clear communication, maintain routines to reduce confusion, and approach situations with patience and empathy. When patients were agitated or confused, I redirected their attention gently and avoided confrontation. I created a safe environment by removing hazards and labeling important items. I also work closely with families to understand triggers and preferences, ensuring continuity of care. Understanding that their behavior was not personal helped me stay compassionate. My goal was always to provide comfort, security, and a sense of familiarity in their daily lives. 13. How do you build trust with a new patient? Building trust starts with being respectful, punctual, and dependable. I introduce myself clearly, explain my role, and listen carefully to their concerns and preferences. I ensure the patient feels heard and involved in their care by asking for their input and honoring their routines. I maintain eye contact, use a friendly tone, and offer consistent support. By respecting their privacy and dignity, I help foster a sense of safety and partnership. I also follow through on promises and communicate openly. Over time, these actions help build a trusting relationship that enhances both care and comfort. 14. How do you handle a patient who is resistant to care? When a patient resists care, I remain calm, empathetic, and respectful. I try to understand the root cause, whether it's fear, pain, confusion, or loss of independence. I gently explain the purpose and benefits of the care I'm providing and ask if there's preferred way or time to do things. I give the patient as much control and choice as possible to maintain their dignity. If resistance continues, I document the behavior and notify the healthcare team to adjust the care plan as needed. Patience and respectful communication often help ease resistance over time. 15. How do you communicate with family members about a patient's condition? I maintain open, professional, and compassionate communication with family members, providing updates within my scope of practice. I share observations about the patient's mood, appetite, daily activities, and any noticeable changes. If I notice anything concerning, I report promptly to the supervising nurse and inform the family as appropriate. I also listen to their insights and concerns, which can help in understanding the patient better. I ensure that all communications are respectful, honest, and confidential, always prioritizing the patient's well-being and privacy. This approach builds trust and supports collaborative care. 16. Can you describe a time when you had to deal with a difficult family member? I once cared for a patient whose family member was frequently upset and critical of the care plan. I remained calm and listened attentively to their concerns, validating their feelings and clarifying any misunderstandings. I explained my role clearly and focused on the patient's needs while maintaining professional boundaries. I kept documentation of interactions and informed my supervisor about the ongoing situation. Eventually, through consistent, respectful communication and reassurance, the family member became more cooperative. This experience taught me the importance of patience, transparency, and teamwork when navigating challenging family dynamics. 17. How do you maintain patient confidentiality? I strictly follow HIPAA guidelines and organizational policies to protect patient confidentiality. I only discuss patient information with authorized healthcare personnel and never share details with others, including family members, unless permission is granted. I avoid discussing patient cases in public or unsecured spaces and ensure that documentation is stored securely. I also use discretion when handling sensitive tasks or personal information. Respecting a patient's privacy builds trust and ensures ethical care. Confidentiality is a fundamental aspect of my work, and I take it seriously to maintain professionalism and protect patients' rights. 18. What safety precautions do you take when assisting a patient at home? I start by identifying and addressing hazards like loose rugs, poor lighting, or clutter that could cause falls. I ensure mobility aids are in good condition and positioned properly. When assisting with transfers or movement, I use correct body mechanics and encourage the patient to do as much as possible independently. I also check that medical equipment is functioning properly and within reach. For hygiene tasks, I maintain cleanliness to prevent infections. I'm trained in emergency protocols and always have a phone nearby in case of urgent situations. Patient safety is always my top priority. 19. How would you handle a fall or medical emergency while on duty? In the event of a fall or emergency, I would remain calm and assess the patient's condition without moving them unless necessary for safety. I would call emergency services immediately if the situation is serious, then contact my supervisor and follow the care agency's protocols. I would stay with the patient, offer reassurance, and monitor their condition closely. If the patient is conscious and alert, I would check for injuries and help them into a comfortable position. After the incident, I would document it accurately and ensure follow-up care is coordinated promptly. 20. What infection control practices do you follow? I follow strict infection control procedures, including regular hand washing before and after contact with patients, wearing gloves and masks when necessary, and disinfecting surfaces and equipment frequently. I ensure proper disposal of contaminated materials and use personal protective equipment, PPE, according to protocol. I avoid cross-contamination by using clean supplies for each patient and practicing proper food safety during meal prep. I also educate patients and families on hygiene and monitor for signs of infection. These practices protect both the patient and myself, especially when caring for individuals with weakened immune systems or contagious conditions. 21. How do you prevent bed sores in bedridden patients? To prevent bed sores, I reposition bedridden patients at least every 2 hours to relieve pressure on vulnerable areas. I ensure the patient's skin is kept clean and dry, using moisture barriers when necessary. I regularly inspect skin for redness or breakdown, especially on bony areas like heels, elbows, and the tailbone. I use supportive cushions or pressure-relieving mattresses and encourage even limited movement when possible. Proper nutrition and hydration also play a role, so I monitor intake closely. I report any signs of skin changes immediately to the healthcare team to address potential problems early. 22. How do you maintain professional boundaries with patients? I maintain professional boundaries by being respectful, compassionate, and friendly without becoming overly personal. I avoid sharing too much about my private life or accepting inappropriate gifts. I keep communication focused on the patient's care and needs while offering emotional support within my role. If a patient becomes too dependent or emotionally attached, I gently reinforce my professional position. I follow agency guidelines and consult my supervisor if boundaries ever become unclear. Maintaining this balance allows me to provide high-quality care while protecting both the patient's and my own emotional well-being. 23. Have you ever encountered an ethical dilemma in your work? How did you handle it? Yes, I once noticed a family member giving a patient food that contradicted the doctor's dietary instructions. I politely reminded the family of the dietary restrictions and explained the potential health risks. When they insisted, I documented the incident and reported it to my supervisor to handle appropriately. I maintained professionalism and respect to the family while advocating for the patient's well-being. Ethical dilemmas require careful judgment, and I always refer to my training, agency policy, and professional values when making decisions. Protecting the patient's health and safety remains my highest priority in such situations. 24. What would you do if you suspected a patient was being abused? If I suspected abuse, I would document the signs carefully and report my concerns immediately to my supervisor or appropriate authorities, following agency and legal protocols. I would not confront the suspected abuser directly, but would ensure the patient was safe and treated with compassion. Signs like unexplained bruises, fearfulness, or changes in behavior are taken seriously. I understand my role as a mandatory reporter and recognize that taking timely action could prevent further harm. I remain vigilant and prioritize the patient's safety and dignity in all situations involving suspected abuse. 25. How do you handle stress and emotional challenges in this job? I manage stress by staying organized, maintaining a healthy work-life balance, and practicing self-care through exercise and relaxation techniques. I reflect on the rewarding aspects of my work and seek support from colleagues or supervisors when needed. Talking with other caregivers helps me process difficult experiences. I also maintain emotional boundaries so I can remain empathetic without becoming overwhelmed. Keeping a positive mindset and focusing on the impact I'm making in patients' lives helps me stay grounded. Continuous learning and professional development also give me confidence and improve my resilience in challenging situations. 26. Describe a time when you went above and beyond for a patient. I once cared for a patient who was feeling lonely and depressed. While maintaining my regular duties, I spent extra time engaging her in light conversation and helped organize video calls with her out-of-town children. I also created a small daily activity routine to lift her spirits. These small, consistent efforts helped improve her mood and encourage her to participate more actively in her care. Her family later expressed deep gratitude. This experience reinforced my belief that emotional support and companionship are just as essential as physical care in a patient's recovery and overall well-being. 27. Tell me about a time you had to handle a conflict with a coworker or supervisor. I once had a disagreement with a coworker over task responsibilities during a shared patient visit. I calmly approached her privately and expressed my concerns without blame. I listened to her perspective and explained mine, and we realized it was a simple miscommunication. We agreed on a clearer division of tasks moving forward. I also informed our supervisor for clarity on expectations. Resolving the issue respectfully strengthened our working relationship and improved patient care. I believe open communication, active listening, and professionalism are key to resolving conflicts constructively in any team environment. 28. How do you manage your time when caring for multiple patients in a day? I manage my time by reviewing each patient's care plan in advance and prioritizing tasks based on urgency and needs. I organize my schedule to allow adequate time for each visit, including travel. I prepare supplies ahead of time and document care promptly to avoid delays. I remain flexible for unforeseen situations while ensuring every patient receives quality attention. Clear communication with patients and their families helps manage expectations. If needed, I inform my supervisor of any schedule conflicts. My goal is to deliver consistent, compassionate care while staying efficient and organized throughout the day. 29. What would you do if a patient refused to follow their care plan? If a patient refused part of their care plan, I would first listen to their concerns to understand the reason behind their refusal. I'd explain the importance and benefits of the care plan and try to address any fears or misconceptions they may have. I'd also offer alternatives, if possible, to find a compromise that still supports their health. I'd document the refusal and notify the nurse or supervisor so the care team could evaluate the situation. Respecting patient autonomy is important, but I also aim to advocate for their well-being through compassionate communication. 30. Why do you think you're a good fit for this role? I believe I'm a great fit for this role because I bring compassion, reliability, and strong hands-on caregiving experience. I've worked with diverse patient populations, including those with chronic illnesses, disabilities, and cognitive impairments. I have the training, certifications, and emotional resilience required to provide high-quality home care. I understand the importance of dignity, empathy, and patience in supporting people in their most vulnerable moments. I'm committed to building trusting relationships, communicating effectively with families, and following care plans thoroughly. My goal is always to enhance patients' quality of life while ensuring their safety and comfort at home. Thank you for watching Top 30 Home Health Aide Interview Questions and Answers. We hope this guide helps you feel confident and prepared. Don't forget to like, share, and subscribe for more career-focused content. Best of luck in your interview and future role as a dedicated home health aide.